Dysfunction.
Flexion.
Flexion. Shoulder flexion. Which muscle involved?
Biceps.
Anterior fibers of deltoid. Pectoralis major. And
Brachialis. Medial.
This one.
Medial.
Clavicular head.
Extension.
Clavicular and sternal. Clavicular head is vertical toward brachial. What is the when this contract, helix is produced. Okay? This one is shoulder flexion, anterior fibers of deltoid, pectoralis major, and
Brachialis.
This one,
Extension.
which nerve, which muscle? Posterior fibers of deltoid, latissimus, dorsi, and pectoralis, and teres, major. Okay? This one. Abduction. First 15 degree is produced by supraspinal middle fiber of deltoid and trapezius. This one.
Latalis major.
Lateral is produced by teres minor, infraspinatus. Lateral rotation is produced by teres minor and infraspinatus. This one.
Pectoralis major.
All muscles involved to adduction, involved to medial rotation. Which muscle?
Pectoralis major.
Pectoralis major, teres major, latissimus dorsi, and subscapularis. This one.
Flexion.
Which muscle?
Biceps and brachialis. Triceps.
This function is elbow bending. Okay? Elbow flexion or elbow bending. Okay? All muscles start with B. Is elbow bending.
Biceps, brachialis. Biceps, brachialis.
Brachialis. And all muscles start with B. Brachio.
Brachialis.
Brachioradius. Okay? Biceps, brachialis, and this muscle, this one. Brachioradius. Brachioradius. Involved in elbow flexion. This one.
Triceps.
Triceps. Elbow extension produced by triceps. Supinator. And biceps. And biceps. This one.
Pronator teres. Pronator longus.
Quadratus. Pronator is round. Quadratus quadrangular. This one. Which flexion? Rest flexion. Muscle involved.
Flexor
carpi radialis and flexor carpi ulnaris. Okay? This one.
Extensor carpi radialis and extensor carpi ulnaris.
But radialis are two muscles. Extensor carpi radialis longus and brevis. Okay? Extensor carpi radialis longus and brevis and extensor carpi ulnaris. This function.
Lumbar.
Lombrical muscles. Okay? These function.
Abduction.
Which muscle?
The dorsal.
Dorsal interosseous. This one. Adduction. Palmar. This one. Flexion. By flexor digitorum profundus. This one.
Intertarsal.
Also flexion of
Flexor digitorum superficial.
yeah, because of
digitorum superficial.
this muscles. So digital. You're talking about this muscle?
Two flexor muscles for each finger. Distal phalanx, flex bar, flexor digital profundus, proximal phalanx, middle phalanx by flexor digital superficial. Okay? MP by lombrical. This one.
Adduction.
Adduction. This adduction. Which muscle?
Pelvis.
Medial carpal muscles. Flexor.
Carpi.
Ulnaris. Extensor. Carpi ulnaris. Okay? Muscles is located in ulnar side, produce ulnar deviation or adduction. Okay? Muscles is located radial side, produce radial deviation or abduction. Which muscle? Extensor carpi radialis longus brevis and flexor carpi radialis. Okay? Carpi radialis lateral side abduction. Carpi ulnaris medial side adduction. What's nerve of flexor carpi ulnaris? Which nerve innervate flexor carpi ulnaris? Ulnar. Flexor carpi radialis.
Radial.
Flexor carpi radialis.
Medial.
Extensor carpi radialis.
Radial.
Extensor carpi ulnaris.
Ulnar. Radial.
Extensor completely radial. Okay? All extensor. Extensor digitorum longus. Extensor digitorum.
Radialis.
Radial. Extensor. Radial. Extensor radial. Abductor pollicis longus.
Medial. Ulnaris.
Radio.
Radial. 11 muscles are located in posterior compartment. All of them are innervated by radial nerve. Some muscles relate to index and pollicis are deep layer, other are superficial. Deep layer origin from
Ulnaris.
radius and
Radius.
ulnar. Superficial layer origin from
Lateral. Epicondyle.
all of muscle. Which muscle attached to base of second metacarpal bone? Metacarpal. Which muscle?
Dorsal.
Carpal muscles. Which muscle? Flexor carpi radialis and extensor carpi radialis longus. You need much time for memorizing.
What about elevation, depression, pronation, retraction? No,
Protraction. For the shoulder.
Elevation of shoulders.
Levator.
Levator and
Rhomboid.
no. elevation. This muscle.
Trapezius. No.
Trapezius. This muscle. Yes, trapezius and levator scapula. Okay. This one.
Sub,
Protraction.
subscapularis.
Serratus anterior and pectoralis minor. This one. Retraction. Which muscle?
Supraspinatus. Infraspinatus.
Rhomboid.
Maybe.
muscles.
Very major.
Subscapulars involved to adduction and mega-adduction. Nerve and vessel of the hand. Nerve and vessel of the hand. This one is palmar surface of the hand. Okay, palmar surface of the hand.
Palmar surface.
You think what is tendon? Tendon of which muscle?
Palmar.
Tendon of which muscle?
Flexor.
Profundus and superficial. This one is said to distal phalanx is profundus. This one attached to middle phalanx is superficial. Okay. When remove skin, we can see
Superficial.
no. When remove skin, we can see palmar aponeurosis.
Palmar aponeurosis.
Palmar aponeurosis. When we remove palmar aponeurosis, we can see tendon of flexor muscles. Okay. There is an anastomos on flexor tendons that is called superficial. That is called superficial palmar arch. Okay? When remove these tendons, we can see deep palmar arch. Okay, so superficial palmar arch lie on flexor tendons. Deep palmar arch is behind flexor tendon. Okay.
Flexor tendons.
What is this? Radial artery. Radial artery. The radial artery can be seen, can be touched, causation, lateral which tendon? Lateral to
FC.
lateral to tendon. Flexor.
That's one.
Yes. Lateral to which tendon? Flexor.
FCR.
Carpi
Radialis.
Lateral to flexor carpi radialis. Okay. This one is lateral to flexor carpi radialis. After it, the artery pass behind of hand and pass this area. What is this?
Snap.
This one.
Snap.
A small box. pass into the slot, enter into the slot box, and pass between first gap. This one is first gap. The distance between first and second first and second finger is called gap.
Yeah.
First gap. This one is
Second.
second,
Third,
fourth
fourth.
gap. Okay. The radial artery enter into the anatomical slot box and come back to palmar surface of the hand to first gap. Okay? The radial artery has a the radial artery has a superficial branch. This one has a superficial branch. This branch help
ايش القرب؟
to
ضوية كيس عصب والمرخية
help to formation of superficial palmar arch. What is this?
Ulnar artery.
Ulnar artery is divided to deep and superficial branch. Deep to superficial branch. The superficial branch of the ulnar artery, the superficial branch.
Same way after.
The superficial branch of ulnar artery forms the superficial branch of ulnar artery forms the superficial palmar arch. And this arch is completed by superficial branch of radial artery. Superficial branch of radial artery. Okay? Superficial palmar arch is formed mainly by superficial branch of ulnar and is completed by superficial branch of radial arch. Superficial palmar arch is formed mainly by superficial branch of ulnar arch.
They join together?
Ulnar, yes. Yeah, ulnar arch. Superficial palmar arch is formed mainly by superficial branch of ulnar arch and is completed by superficial branch of radial arch.
GG.
The superficial palmar arch
Okay,
has
the
these branches. Superficial palmar arch has these branches. What's your idea about name of this branch?
Langeal.
No. This branch is move toward
Meta.
fingers.
Digitile.
branch. Palmar, the superficial arch, has some digital branch for supply of fingers. Okay? But this branch supply 3.5 medial fingers. 3.5 medial fingers. The thumb and radial side of index finger, the thumb, and radial side of index finger supplied directly by radial artery. Radial artery. Directly by radial artery. These branches are named principal, pollicis, and radialis indicis. The name implied supply area. Principal pollicis mainly supply thumb. Radialis indicis supply radial
second.
side of the
Second.
index finger. Second finger. Okay?
What the first branch?
This one?
Principal.
This one is
Think.
principal pollicis. Both side of the thumb.
No?
The radial artery has a deep branch. The radial artery has a deep branch. Deep branch. Deep branch. The deep branch of the radial artery form deep palmar arch. Okay? The deep branch of radial artery forms deep palmar arch, and this arch is completed. This arch is completed.
Ulnar.
This arch is completed by deep branch of ulnar arch. Deep branch of ulnar arch. Okay? The deep palmar arch, is formed mainly by
Radial artery.
radial artery and is completed by ulnar arch. This is
Too much.
Too much.
very difficult. It's very easy. Formula. Hand. This part is thick, is large, or this part.
This thing.
This part,
Thinner.
radial part. Radial artery forms deep palmar arch because this part is very deep. Radial artery forms a deep palmar arch. This one is thin. Ulnar artery forms superficial because this one is thin, is narrow. Okay?
So the same as the nail of the nerve.
Yes. Deep palmar arch is formed mainly by radial artery and is completed by ulnar artery. Superficial is formed mainly by ulnar artery and is completed by radial. What is border between superficial and deep palmar arch? Flexor digital tendons. Superficial is on flexor tendon.
Deep is
Superficial. Deep is deep to tendon. Okay? Deep is proximal. Superficial is distal. Deep is proximal. Superficial is superficial. Superficial is distal. Okay? What is Name of this branch.
No.
Name of this branch.
Is
What
this
is the
top?
name of this branch? No, metacarpal. Because this branch lie on metacarpal bones. Very good. Okay?
وين؟ خيلي لا بس انت
Sorry?
حتى انا
Rest.
Against the wall? There's the yeah.
My
Two 10. Easy.
That means
ويلي على الكعبة
head of the radius contribute to formation of the elbow joint by joint to capitula. Okay?
جعفر واضح.
Elbow joint is formed by trochlea and capitula of humerus, trochlear notch, and head of the radius. Okay? Head of radius must be maintain this position. For this reason, there is annular ligament. But annular ligament is wide, but head is narrow. For this reason, when
Detachment, because detachment of the elbow?
yes, this traction produce dislocation of the radius because annular ligament is wide, cannot maintain head of radius in its position. Okay? For this reason, you cannot this activity. Elbow of the infant is dislocated.
Just the head of the radius?
Head of the radius.
Just
just head of the radius. Okay?
definitely.
This one. What is this?
Herbs?
Herbs. Policeman. Okay.
Herbs,
Herb palsy.
The
Herb
police.
palsy. Herb palsy produced by injury to upper part of brachial plexus. C5 and C6. Okay, this one is herb palsy. In what's problem?
Hammer's head. The hammer's head.
Hyperextension?
Which muscle? Which muscle?
Oh.
Which muscle?
Deltoid?
Deltoid, yes. Which nerve?
Bracket.
Axillary nerve is caught, deltoid is paralyzed. For this reason, deltoid is atrophy, deltoid is small. And you can see head of humerus. Okay? This one, Saturday night palsy or crutch palsy. I am drunken. This part pressure on brachial plexus, especially radial nerve. The radial nerve is injured and produce
Paralysis of the whole arm?
this one. But why? This one is hand drop. Hand drop produced by paralysis of extensor muscles. Extensor muscles are innervated by radial nerve. Okay? Crutch. When your leg is fractured, you use crutch. Okay? Crutch pressure on radial nerve produce this phenomenon. What is this? This one.
Biceps.
Detachment of the head of the biceps.
Biceps. Long head of biceps is rupture. Long head of biceps is rupture and muscle move to lower part.
هذا عارفه هذا الشيء.
This one.
Carpal tunnel.
دلتا ولا شنو؟
This is a tennis ball.
اها.
Dysfunction.
Dislocation. Dislocation.
Backhand.
Rupture.
Extension.
Rupture.
Lateral epicondyle muscles. Which muscles?
Peries.
Extensor muscle.
Extensor.
Superficial extensor muscle.
deltoid and
has,
triceps.
has a common tendon on lateral epicondyle.
Right.
Okay? This
Extensor
tendon
cardi.
is inflamed. It's called
Yeah.
tendonitis.
Nitus.
Tendonitis. Itis is inflammation. Okay? This phenomenon produced in this sport.
Uh-huh.
For this
Because of the
sport,
extension.
tennis elbow.
Tennis elbow.
Tennis elbow. Inflammation of lateral epicondyle. Okay?
Formation of
Or use extensor muscle of the hand and wrist.
Uh-huh.
This one,
Golfer's golfer's elbow.
golf's elbow. Golf, flexion of muscles.
Flexion of muscle.
Where is location of common tendon of flexor muscles?
Lateral.
Medial
Medial.
epicondyle. Medial epicondyle.
Lateral. Medial.
This is like normal movement or disorders.
This is disorder. Overuse of muscles produce this phenomenon.
So this is common in golfers.
Golf, yes.
مو كده.
This one.
مو طيب.
Maybe all of you involved this
Carpal tunnel problems.
tendon of extensor pollicis longus and brevis is inflamed.
Mhm.
Is inflamed and produce a pain on this area. Tendon of flexor, extensor, pollicis longus and brevis. For test, you must stretch muscle. Test. Okay? Flexion of finger and abduction of wrist.
Sometimes.
This one.
Doctor, what about this
all
part?
all people that overuse writing involve this phenomenon.
Yeah.
Okay?
What
All
about
of them are painful. This one. There is a structure below skin. This structure is called palmar hand.
Palmar hand.
There is a structure below skin. What is the structure? Palmar aponeurosis. Okay? When we move the skin, we can see palmar aponeurosis. Medial side of palmar aponeurosis may be contracted and form this disability, this one. This one is dupoitran contracture. Dupoitran contracture, 4 and 5 finger is flexed and distal phalanx pressure and move extend. Okay? 5 and 4 P joint. In MP joint. No, this one. In MP joint. And distal phalanx pressure on hand and move to extension. This one is called Dupuytren syndrome. Dupuytren.
عندي بعض حاجة ما أقدر أحركها.
Dupuytren. Okay, but when ulnar nerve is injured, ulnar nerve is injured. The ulnar nerve innervates all muscle of the hand except thumb muscle. Okay. When this muscle is paralyzed, extensor muscle is good because radial nerve is good. Okay, it's
Just the
not
flexors.
injured.
Externals.
For this reason, this muscles in AP joint is extend. Passively, phalanx is flexed. This one is called claw hand. Okay? Muscles of the hand is paralyzed, but extensor of the hand is good. Extensor muscles extend MP joint. When extend MP joint, simultaneously finger move to flexion position. This one is claw hand. It's produced by ulnar nerve injury. This one
Radial.
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 Oh no.
When median nerve injury,
The thumb.
this muscles, this area is called tenar. It's flat.
Thick.
The shape of hand is like the ape. Okay, this one is no observer. Okay, and only these muscles move. The hand is like an ape hand. For this reason, it's called the ape. What is difference between hand of ape and hand of human? Movement of tongue.
They don't have it.
When the movement
أيب،
of
شنو يا حيوان؟
tongue is
قرد.
removed,
قرد؟
قلت ما أتذكر.
only my
أنواع
hand is
الشمبانزي.
like an ape hand. Ape hand. Okay?
الأيب يطمن، الغوريلا، الشمبانزي.
This one is
كده.
Dupuytren. Dupuytren is produced by contraction of
median.
palmar aponeurosis.
Median nerve.
Palmar aponeurosis.
Palmar.
Median nerve injury is very common. It's very common. For diagnosis, there are two tests. One test here, Falcon test. 60 second time. If you don't endurance this position, you involve to median nerve injury. Okay. Other test is thinner test. Okay, you follow. Other test is here. Median nerve is here. Okay. When you tap on median nerve, lateral rotation is difficult because two muscles produce. Okay.
This one is a broken hand.
Okay, I tap on median part of the wrist. This area is passage of median nerve. I tap on median nerve. If median nerve is injury, 3.5 fingers is irritation.
Those two.
Yes. This one is tunnel test.
هي لا ممكن
when
كده.
this test, when this test is positive, 3.5 finger is irritation, burning. Okay? When tap on median nerve, if 3.5 finger is irritation, the median nerve is injuriable, is disorderable. Okay?
إذا صار في injury ذني راح يقوم من
يكون يعني اكثر احتماليه بالاصابه.
يعني تحس انه كل شيء بيخلط من علاجات الاعصاب وده هيك شيء باليهمات
No, no. Balloon, yes. Wait. This one test of ulnar nerve. Okay? Ulnar nerve
Because
is
the
good
median.
because adductor muscles or interosseous muscles are good. Okay? If the ulnar nerve is injured, we cannot maintain it. Okay? This one is test of ulnar nerve. And finally, we learn anatomy for future. Okay? This one is normal hand, this one is
Down syndrome.
Down syndrome hand.
Because there is no like 18 and
We have
18.
two
They have just
transfers in my hand. Okay? But
They have only one.
Down syndrome has one crease that is called simian crease. Okay? Every time you must able to diagnose chief company of patient. Okay? Chief company of patient. Main difficult of patient. Okay? By observation. When I come you, what is my problem?
Injury.
What is my problem?
Paralyzed.
Of this muscle.
Trapezius?
Trapezius. Okay? Only by observation. Okay? Okay.